Hi everyone, welcome back. In this video, I'm going to compare some of the most frequently used dental crowns. It is almost a general topic in dentistry, but I assume for everyone can add some useful information whether you are a dentist, dental technician, or someone seeking information about common dental crowns. The crowns we are discussing today are Emax, zirconia, and PFM. Let's see how these crowns are different. Nowadays, even for dentists, it could be confusing what to choose because there are several factors to be considered, such as cost, strength, durability, and of course, aesthetics. A natural appearance may be the prior option for the patient, but this is not the whole story. When deciding the material of the crown, it is important to examine the tooth location I'm speaking of, being anterior or posterior, position of the gum tissue, function of the tooth that needs the crown, how much natural tooth is remaining after the preparation, and also color of the prepared tooth in addition to color of the adjacents. Let's get to the point and start with the monolithic zirconia crowns. The great advantage of a monolithic zirconia crown is that it is stronger than its competitors in aesthetic dentistry. And on the other hand, because of being monolithic, it requires less preparation that can solve many times the problem of not having enough space for prep or for porcelain. But on the contrary, the monolithic zirconia crown can cause abrasion of the antagonist teeth via occlusal. A study shows that the amount of wearing is higher than that of natural teeth and increases over time, especially if the crown is not polished. It is better to finish the crown polished instead of glazed. It is a good point for lab technicians because after the removal of glaze layer over time, unpolished crown wears the enamel much faster. Next common crown that is widely used is PFM crown, or let's say porcelain fused to metal. As the name indicates, this crown is made of a metal coping, a layer of opaque, then following by dentine and enamel porcelain. PFM crown was invented in 1960s and is used for decades now. Although there are more aesthetic options rather than a PFM crown, this type of restorations are still popular because of two main reasons: durability and price. Because of their strengths, PFM crowns and bridges are ideal choices for restoring teeth in posterior areas, also for making longer bridges. They can also be recommended for patients who grind their teeth. It is good to know that the tooth preparation should be enough for a PFM crown, otherwise there is a great chance of porcelain chipping. Another option, and the last one today, is the lithium disilicate, or known as Emax crown. When we speak about an Emax crown, nothing can beat its aesthetics and perfect bonding in practice. Emax crown has an ideal blend of translucency and lifelike appearance, which makes it suitable for the restoration of front teeth. These crowns are more translucent than zirconia crowns, but this is not all. Although an Emax crown gives a nice result as a natural tooth, it is less strength compared to other options, and for posterior area it needs more thickness to meet the safety. As Emax is more translucent than zirconia, they look more natural than zirconia. However, if the natural color of prepared tooths are so dark, zirconia crown might be a better choice. Let's take a look at some clinical aspects of choosing a crown. Of course, there are some abnormal functions in some patients, such as bruxism, and as you know, it is a habit of grinding the teeth and is usually due to stress or anxiety due to heavy forces applied. Because of bruxism, the chance of crown breakage is high. The mentioned fracture happens more in layered crowns, I mean those with ceramics. In some cases, the height of the prepared tooth is less than normal. In such cases, it's better to go for a monolithic crown because, as mentioned before, They need less space for fabrication compared to layered restorations. I hope you find this video useful and please leave your opinions in the comments. Stay tuned for the upcoming videos. Good luck.